see that, yeah, one of them,
yeah. How's your career developed since graduating at university?
Well, I started off obviously working, working clinically with patients, working in the community and general dental practice. And then I realised that actually I was very interested in clinical leadership. I ended up actually leading a very large community dental service and the dental hospital here in Birmingham. From then I realised that actually I was very interested in clinical policy. And so I was fortunate to be appointed as the Deputy Chief Dental Officer for England. And I have to say I've enjoyed probably every minute of it so far.
Good. Do you feel that the NHS and dentistry has changed throughout your career?
Oh, undoubtedly, yeah. Absolutely. I mean, the NHS has obviously changed and developed. I think one of the things with the NHS that's changed very much is it's very much more patient-focused than it used to be. So now services are developed around patients and patients are actually involved in decisions about their treatment, which I think probably when I qualified as a dentist that wasn't the case. Whereas now I think we have far more, we work in partnership with our patients. So I think that's one change. I think the other change I would pick out is actually the huge focus that we have now on quality and things like infection control. When I qualified we didn't wear gloves, and now the idea of putting our hands into a patient's mouth without gloves fills us with horror.
Who's inspired your NHS career the most?
Well, I suppose the person I would pick as my role model would be Dame Margaret Seward, who was the second president of the British Dental Association. She was a chief dental officer in England. She edited the British Dental Journal. So she had a really varied career, really, a portfolio career before they became fashionable. But as well as all of that, she's actually a tremendous person, very engaging, a total role model, somebody that I've actually tried to emulate throughout my career. And whenever I'm stuck for anything, I think, what would Dame Margaret do? And then I do it. So I absolutely take my hat off to her. So why did you decide to study dentistry at Birmingham then?
So I decided to do dentistry because my mother's a general practitioner, and so I was always interested in healthcare, and I loved how we live in a small town and everyone knew her and everyone was so grateful for the help that she gave them. So I always knew that I wanted to help people in any small way I could.
So where do you see yourself in 5 years' time then, Ellen?
Well, I'm not too sure at the moment, but I've really been enjoying the clinical aspect of it. I like treating patients, but also I think my role as Vice President of the European Dental Students Association has developed an interest in dental public health and policy making and networking. So if I could find a role where I could do a little bit of both, that would be perfect.